Welcome to today's traditional Chinese medicine acupressure session. We're going to be tracing the spleen meridian from the toe all the way up to sort of mid-thigh bilaterally. So let's begin with spleen 1. Spleen 1 is Yin Bai. It's found right on this medial side of the big toe. So I'm just going to make a little arrow on both sides, pointing to it. Next, we have spleen 2, Da Du. That is on the medial side of the big toe, distal and inferior to the first metatarsal phalangeal joint, at the junction of when the skin's pigmentation changes. So right about there. There. Okay. Next we have spleen 3, Tai Bai. This point is proximal and inferior to the head of the first metatarsal bone at the junction of where the skin changes pigment. That's the first metatarsal bone right here. You'll find it right down there. Just working on that side as well. Great. Spleen 4, Gong Sun. This is in the depression distal and inferior to the base of the first metatarsal bone. And again at that junction where the pigment changes. In Chinese, they say it's the junction of the red and white skin. I just have a diagram that I can follow as well. It's right about there, spleen 4. Okay. Okay. Spleen 5 is Shangqiu, and it is in depression distal inferior to the medial malleolus, midway between the tuberosity of the navicular bone and the tip of the medial malleolus. You can find a little depression there. Spleen 6, Sang Jiao. This is a point that I use very, very often. So in order to locate the points of the lower limb of the leg, we want to start with the medial malleolus right up to the tibial plateau, right over here. That's 13 Sun. I like to use my thumb. My thumb is about comparable to your thumb, so I'll use it as a way of measurement. And that's 1 Cun right there. 12 Cun. 12 is a form of measurement in Chinese. Pretty similar to inches, but not quite. Now, if I want to find the next point, spleen 6, 7, and 8, I will divide this by 3. Actually, I'll divide it by 4. So that's 12 divided by 6, right about there, and then there. So the next point, so that is spleen 6. Let's make a little arrow. And spleen 7, again, tibial plateau, 1 sun right there, medial malleolus, divided by half, 1/3, right there. It's also spleen 7, joining the tip, posterior border of the tibia. You want to find it right at the border of the tibia. So you find that the tibia actually kind of shifts. Well, it kind of comes in a little bit in this position, so it's right there, and then it's up more over here. So I'll just make a little mark. And spleen 8 is 3 tsun over, so we said the tibial plateau is about here, 1 tsun, about halfway between spleen 7 and this point right here, right there. Also on that posterior border of the tibia, find that depression. And finally, spleen 9 is just distal to the lower border of the medial condyle of the tibia. So you'll find it kind of in that depression on the medial border of the tibia. You'll find it right here. It's such an important point as well. Yeah. So let's do the same thing over here on this leg. So starting off with this, that's 1, 2, 3, 4, 5. So 6. Tibial plateau right there, medial malleolus halfway, and right in between that spleen 6 on the posterior border of the tibia. Good. And then go halfway there. It's spleen 7. And then from there, we're going to find spleen 9. Just right in that depression, medial condyle of the tibia. And then roughly halfway between 3 tsun distal, which we can also find using the 4 fingers. Hopefully I would say it's about there. Posterior border right there. Good. And spleen 9. Then we're going to find spleen 10 and 11 and go ahead and do all the massage. All right. So next we're going to find spleen 10, medial superior border of the patella. We're going to go 2 tsun proximal along this line right here. So to find 2 tsun, I like to use 3 fingers, and then you'll find that little depression right there. Perfect. 2 tsun, same on the other side. Superior border. Just find that depression. Okay, good. It is right next to the bruise that you have, so I'll make sure to avoid that bruise when I'm massaging it. I don't want to cause more irritation of that area. Next is the final one, spleen 11, which is 6 tsun proximal to spleen 10. Okay, I'm going to find the pubic symphysis. Upper pubic symphysis is right along here. And then the patella, right, the upper superior border, that's 18 tsun, yeah. And we're going to go 6 tsun proximal, so that's about 1/3 up. follow that line there. It's going to be joining spleen 10 and spleen 12. So right over there. Perfect. Same thing on this side. So pubic, upper border of the pubic symphysis, upper border of the patella, 18 thirds. About there. Following right there in that depression. Perfect. Okay, so let's go ahead and massage and do the sweeping with the wormwood and the essential oils. I want to start by applying this mugwort essential oil onto each point, starting at spleen 1. Just following the meridian. Mugwort is a really warming, tonifying herb. It's used in traditional Chinese medicine to help tonify qi. And it also expels damp and cold. So, very powerful herb, especially when you heat it up. But I will use friction-based massage to warm this up and allow it to infuse into the skin. Following meridian all the way. Because it's late summer at the moment, in the 5 elements of traditional Chinese medicine, this is the season for the earth element. The spleen is the yin organ of the earth element. Just one more pass through. So, late summer, we tend to experience more dampness in the body, and there's more of a propensity to have dampness, especially leading up to the winter. We really want to work on expelling that and tonifying the spleen qi before the colder months set in. Spleen in the traditional Chinese medicine theory is not the same as the spleen in Western medicine theory. It's more analogous to the pancreas, actually. Right. Just double check that, actually. And it's responsible for transforming and transporting nutrients. So a lot of that digestive function, transforming gu qi, which is nutritive qi, and transporting it throughout the body. It's also responsible for mental focus and clarity. So, because you work a very mentally taxing job, it's very likely for your spleen qi to be depleted. And to be honest, most people who live in the Western world have very depleted spleen qis. I just want to hold this point here, spleen 9, a little bit longer, because it's the point that can help to resolve dampness. I want to do a little bit more work here with the spleen 9. This is the Yin Ling Quan water point, resolving dampness, harmonizing the spleen, benefits the lower burner, benefits urination, removes obstructions, and regulates water passages. A lot of benefit in abdominal issues like abdominal pain, distension, diarrhea, but also fluid issues like edema, and dysuria, or even jaundice, incontinence of the urine, even knee pain and lumbar pain. Next we have Shihai. This point right here. Again, I'm going to make sure I avoid your bruise there. This point is helpful for moving blood, regulating the menses, moving stagnation, nourishing blood, nourishes nutritive chi. So it's helpful for any menstrual issues like irregular menses, dysmenorrhea, amenorrhea, etc. Just do a little bit of work here. Finally, spleen 11. This is Jimen. Also regulates urination, regulates water passages. Okay, good. I want to go ahead and do some sweeping with the Wormwood. Do some rocking here. Vibration. Especially right here where you were feeling all of that stimulation. Felt like it was doing what it needed to do. The De Qi sensation we call in traditional Chinese medicine. Pressing it like a poultice into the skin and deeper. Spirit is the chi. Okay. Okay, perfect. Just going to then use kidney 1 to ground you in this moment before we move on to the next points on your back. Take a deep breath in, hold, and exhale. Letting all of that anything that doesn't serve you, just enter into Mother Earth as compost to be reused. Small intestine 9, Tianjin. Tianjin is one sun superior to the tip of the posterior axillary fold. So just using my thumb here. One sun. Right there. There. Good. Small intestine 10. And the depression inferior and lateral to the scapular spine directly superior to small intestine 9. Inferior and lateral. Okay, so we find this scapular spine up here. Inferior and lateral. But in that line, just above posterior axillary fold. Okay. Small intestine 11, Tianzong, is on the midline of the infrascapular fossa, the junction of the upper third and middle third of the distance between the lower border and the inferior angle. There's the inferior angle, lower border of the scapular spine. Scapular spine is right here. So we're going to find the junction between the upper third and middle third, but in the midline of that infrascapular fossa. So right there. And same thing, find that inferior angle, scapular spine, upper middle third, in the center. Bam. Small intestine 12 is directly superior to the small intestine 11, but in the center of the suprascapular fossa. So, suprascapular fossa. It's kind of right in the supraspinous area. Okay, good. Small intestine 13 on the medial extremity of the suprascapular fossa, approximately midway between small intestine 10 and the second thoracic spinous process. Small intestine 10, we've already marked it there. And we want to find the first thoracic spinous process. So C7, seventh cervical vertebrae is right there, that protruded area. First thoracic is right here, so you want to go right midway between the two. So right here, and it's on that medial extremity of the suprascapular fossa. So just where that bone, the scapula, kind of ends. So right about there. Good. Right about. That's where it ends, so right about there. Good. Yes. Just that, so it's right over here, actually. Yeah, there. Then small intestine 14, Jian Wai Shu, 3 twin lateral to the lower border of the first thoracic spinous process at the medial border of the scapula. To the lower border. Yeah. There. Small intestine 15 is 2 twin lateral to the 7th cervical vertebra. So, just looking for that medial border of the scapula again. That's 3 twin. There. Again, 7th. You can also use fingers. The lower border. Yeah, lower border. Okay. There. Yeah. Cool. And there. Next, Tian Trong, small intestine 16, posterior border of the sternocleidomastoid mastoid. And it's level to the laryngeal protuberance. So just found it, coming all the way back and on that posterior border. So right there. Just follow that to the other side. Posterior border of the sternocleidomastoid, right there. Okay. Next, posterior to the angle of mandible, small intestine 17, the depression on the anterior border of the sternocleidomastoid. There. And can't quite see at the moment. So let's go ahead and apply the Mugwort essential oil along the meridian. So, small intestine 9, 10, 11, 12, 13, and 14. 14, 15, 16, and 17. So one more time. 9, 10, 11, 12, 13, 14, 15, 16, and 17. Other side. 9, 10, 11, 12, 13, 14, 15, 16, 17. 9, 10, 11, 12, 13, 14, 15, 16, 17. Let me know if that's okay. If it's too strong, just let me know. Releasing all of that tension here. Take a deep breath right here. Hold. And exhale. Good. Just keep breathing. This one. Okay. Some light touch tracing, activating the parasympathetic. Spraying with a little bit of this Forest Frolic hydrosol, cool you down. Okay. Hope you enjoyed this session. Take it easy for the rest of the weekend so that all the work that we did can just continue to do its work and repair on your body and your organ systems. And you should feel quite re-energized in a few days. Okay. Thank you so much and take care. Bye.